The experienced nurse was certain the young black doctor was making dangerous mistakes and refused to follow his medical orders. But when the hospital supervisor arrived to handle the insubordination, she discovered the nurse had just challenged the new chief of surgery. Don't forget to subscribe, leave a like, and a comment before we start to learn more about what happened. St. Mary's Medical Center operated as one of the region's premier healthcare facilities, its reputation built on decades of medical excellence and a nursing staff renowned for their expertise and dedication to patient care. The hospital's cardiac unit, in particular, had earned national recognition for innovative treatments and superior patient outcomes under the leadership of some of the country's most skilled medical professionals. Dr. James Williams entered the cardiac intensive care unit at 6:45 a.m., beginning his first official rounds as St. Mary's newly appointed chief of surgery. At 34, James had earned his position through exceptional skill, innovative surgical techniques, and a track record of success that had made him the youngest department head in the hospital's 127-year history. James approached bed 12, where 67-year-old Robert Martinez was recovering from complex cardiac bypass surgery performed the previous evening. Mr. Martinez's post-operative condition required careful monitoring and precise medication adjustments to ensure optimal healing and prevent complications. Carol Henderson had been working in St. Mary's cardiac unit for 22 years, building a reputation as one of the hospital's most experienced and knowledgeable nurses. At 51, Carol took considerable pride in her clinical expertise and had developed strong opinions about proper patient care protocols based on more than 2 decades of hands-on experience. When Carol saw Dr. Williams examining Mr. Martinez's chart, she immediately began assessing the young physician. She noted his apparent youth, his race, and his unfamiliar presence in the cardiac unit. In her experience, the most competent doctors were typically older, well-established physicians who had proven themselves through years of practice. Dr. Williams reviewed Mr. Martinez's vital signs, laboratory results, and medication history before making several clinical decisions about adjustments to his treatment plan. Mr. Martinez is showing signs of fluid retention, Dr. Williams said to Carol. I want to increase his Lasix to 80 milligrams twice daily and reduce his IV fluid rate to 75 milliliters per hour. Carol looked at the young doctor skeptically. Doctor, are you sure about that dosage? That's quite aggressive for a post-operative cardiac patient. Dr. Williams double-checked the chart and patient assessment. Yes, his creatinine levels are stable, and the fluid overload needs to be addressed to prevent pulmonary complications. Carol had worked with many cardiologists over the years and felt confident in her clinical judgment. With respect, doctor, I've seen similar cases, and that Lasix dosage could be dangerous for someone his age. Dr. Williams remained patient but firm. I understand your concern, but based on his kidney function and current fluid status, this is the appropriate intervention. Carol decided to push back more directly. Doctor, I've been working cardiac patients for over 20 years. I know what works and what doesn't. That dosage is too high. Dr. Williams looked at Carol with growing concern about her unwillingness to follow medical orders. Nurse Henderson, I appreciate your experience, but I need you to implement the medication changes I've ordered. Carol crossed her arms defiantly. I'm not going to administer medication that I believe could harm the patient. You look very young, and I question whether you have enough experience to be making these kinds of decisions. Other nursing staff began to notice the confrontation, and several patients in nearby beds could overhear the dispute about medical competence. Dr. Williams felt his authority being publicly challenged in a way that could undermine patient care and staff morale. Nurse Henderson, are you refusing to follow physician orders? I'm exercising my professional judgment, Carol replied loudly. I have a responsibility to protect patients from inappropriate medical decisions. Dr. Williams realized the situation was escalating beyond a simple disagreement about treatment protocols. Nurse Henderson, I need to speak with you privately. No, Carol said firmly. I want witnesses to this conversation. I've seen too many young doctors make mistakes because they think their medical degree makes them infallible. The commotion attracted the attention of charge nurse Patricia Moore, who approached to understand the source of the disturbance. What's happening here? Patricia asked. Carol turned to her supervisor with relief. Patricia, this doctor is ordering medication dosages that I believe are dangerous for Mr. Martinez. I'm refusing to administer them. Patricia looked between Carol and Dr. Williams, trying to assess the situation. Doctor, could you explain your treatment rationale? Dr. Williams calmly outlined his clinical assessment, the patient's laboratory values, and the medical justification for his orders. His explanation was thorough, evidence-based, and demonstrated sophisticated understanding of cardiac pharmacology. Patricia found his reasoning sound but was concerned about the public confrontation. Dr. Williams, perhaps we could discuss this in the conference room. Before Dr. Williams could respond, Carol interjected, Patricia, I don't care how articulate he sounds. He looks like he just finished medical school. I'm not putting a patient at risk because some young doctor wants to prove himself. The comment revealed the ageist and racial bias underlying Carol's resistance to Dr. Williams's authority. Dr. Williams decided it was time to clarify his position. Nurse Henderson, I think there's been a misunderstanding about my qualifications and role here. What misunderstanding? Carol asked dismissively. I'm not just some young doctor. I'm Dr. James Williams, the new chief of surgery. Carol stared at him with disbelief. Chief of surgery? You can't be serious. Patricia's face went white as she realized the magnitude of what was happening. Carol, Dr. Williams was just appointed chief of surgery last week. His credentials and experience are exceptional. Carol looked between Patricia and Dr. Williams, her confidence beginning to waver. But he looks so young. Dr. Williams pulled out his hospital identification, which clearly displayed his title and department. Nurse Henderson, I completed my surgical residency at Johns Hopkins, my cardiothoracic surgery fellowship at the Mayo Clinic, and I've performed over 2,000 cardiac procedures in my career. Carol studied the ID, her assumptions crumbling as she processed the information. I was recruited to St. Mary's specifically because of my expertise in minimally invasive cardiac surgery and my research in post-operative care protocols, Dr. Williams continued. Patricia stepped forward, clearly mortified by the situation. Dr. Williams, I sincerely apologize for this incident. Dr. Williams looked at Carol, who was now staring at the floor in embarrassment. Nurse Henderson, I want you to understand what just happened here. You questioned my medical orders not because of any clinical evidence, but because I didn't match your assumptions about what a department chief should look like. Carol struggled to find words. Dr. Williams, I made a mistake. I should have trusted your professional judgment. The issue isn't just about trusting my judgment, Dr. Williams replied. It's about the assumptions you made based on my age and race. Those assumptions led you to publicly challenge my authority in front of patients and staff. Patricia realized the broader implications of the incident. Dr. Williams, this is completely unacceptable. We need to address this immediately. Dr. Williams considered his response carefully. What I'm most concerned about is how this affects patient care. When nursing staff refuse to follow appropriate medical orders based on bias rather than clinical evidence, patients suffer. Carol finally looked up from the floor. Dr. Williams, you're absolutely right. My behavior was unprofessional and discriminatory. I let my assumptions override my professional obligations. Dr. Williams appreciated her acknowledgement, but wanted to address the systemic issues. Nurse Henderson, this incident suggests we need better communication and respect protocols between medical staff. Patricia nodded. Dr. Williams, what do you recommend? I think we need comprehensive training on professional hierarchy, implicit bias, and collaborative patient care. Medical decisions should be based on evidence and expertise, not assumptions about appearance or age. Over the following weeks, St. Mary's implemented extensive training programs on respectful communication, professional hierarchy, and bias recognition in healthcare settings. Carol Henderson completed additional training on working effectively with diverse medical staff and became an advocate for examining assumptions about competence and authority. Dr. Williams's medication orders for Mr. Martinez proved to be exactly correct. The patient made an excellent recovery and was discharged 3 days earlier than typically expected for similar procedures. The incident became a case study used throughout the hospital system to educate staff about the importance of respecting medical expertise, regardless of a physician's age, race, or appearance. St. Mary's nursing satisfaction scores improved significantly as staff learned to communicate more effectively with diverse medical professionals, and the hospital's reputation for collaborative care was enhanced. Dr. Williams continued his excellent work as chief of surgery, implementing innovative protocols that improved patient outcomes while fostering a culture of mutual respect among all medical staff. And Carol Henderson never again questioned a physician's orders based on assumptions about their appearance, having learned that expertise and experience don't always match preconceived notions about what medical authority should look like. Because sometimes the most important prescription is the one that cures bias, prejudice, and the dangerous assumption that competence has a specific color or age.